Now, the World Health Organization, that's the WHO, officially declared the outbreak of a coronavirus disease 2019 a public health emergency of international concern on January the 30th, 2020. The race for a vaccine kicked off and has fortunately yielded results. This has, however, not checked the impact of the pandemic, with countries struggling to cope with rising infection rates. All efforts in Nigeria are geared towards reducing community transmission of COVID-19, even as the search for local remedies continue. Joining me in the studio is Pascal Achunini, CEO, Health Emergency Initiative. Good morning.
Good morning. Thanks for having me.
You're welcome. And via Skype from the United States of America is Dr. Gertrude Chiemeka Ayanwoke, right? Medical Director, Infectious Diseases Associates of BRM Baton and ANPA COVID-19 Task Force Chair, ANPA Louisiana. Good morning. Thank you for joining us on The Breakfast Show.
Thank you for having me.
Right, let me begin with you, Gertrude. Talk to us the situation in Louisiana. We know the numbers keep rising and there are concerns of even reinfection. In spite of the vaccine, would you say that there is some sort of, some level of abating with regards to the level of infections with the vaccine that is available to the U.S. as we speak?
Thank you. The issue of the vaccine and if the infection is abating, you know, what happens is that whenever there is an occasion that causes a lot of people to come together, there is more infection in that situation. So yes, it's abating right now, but you have to remember that we had Thanksgiving at the end of November, and a lot of people traveled, even though the CDC advised people not to. So we were seeing a spike as a result of that by December. And then we ended up having Christmas, and then the next week we had New Year. So a lot of the infections we saw and hospitalization was a result of the possible twin spikes as a result of these situations. Ever since after New Year, a lot of people returned to their usual places of abode with decreasing in traveling. That also decreases infection. So you see the infection slows down weeks later. And after a lot of hospitalization and people even dying as a result of it. So now we are into February, it's slowing down. And it's abating in a lot of places, not necessarily because of the vaccine, because we don't have that many uptick. We still are struggling to vaccinate people over here. And you know, the vaccine companies have promised hundreds of millions of more doses, but we will get there, but not right now.
All right, let's bring the conversation to the studio where we have Pascal Achunini. She has said that in spite of the vaccine, they are still struggling to vaccinate the population. And recently, over the weekend, some African countries got vaccines, delivery of vaccines, and Nigeria was excluded. Why? Because WHO came out to clear the air, saying that if Nigeria was giving about 100,000 doses, it was just going to be a drop in the ocean. And these other countries were witnessing a larger number of deaths as a result of the pandemic. And so they had to, Nigeria, wait, but later in this month, we'll get another vaccine. And that is where we are right now. But then it talks about perhaps we need to start looking inwards, because it talks about the cost of even getting the vaccine is another issue. But for you, what is the most concerning? Because you would recall at some point that this man came out to say that we should focus on building our health facilities instead of focusing on acquiring vaccines at this point. I mean, for you, where should we stand? What should be our focus now, seeing that perhaps we are not witnessing as much death as other countries, but something has to be done, whether we like it or not?
Absolutely, something must be done. Some of the things ought to be done yesterday, but we still have today to fix some of the issues that are staring us on the face. And on the angle of vaccine, we still have a need, especially for health workers, for vulnerable people. We still have the need to acquire the vaccine and administer, at least to minimize the risk of infection, because as we speak, the infections per day is still in the thousands. And if you look at it critically, 10% out of every 100 people that get infected end up in isolation center. And sometimes 1% or 1.2% die. So that means if we have 130,000 infected, there's a chance that between 1,300 to 1,500 might die. And we don't have a cure yet. So the next thing close to cure is the vaccine. But more critically is perhaps the concern some people, some is not be verified. Some have said that we didn't have the infrastructure to manage the...
But there are talks that the cooling chain that was used for the poliovirus is something that we can adopt at this point.
For is minus 70 degrees temperature, especially for Pfizer vaccine, I don't know if, because that means that wherever it is kept, end to end, up to the point of administering the vaccine, you must maintain that
temperature.
That temperature. For Moderna and the ones from India, perhaps China, they can align with the temperature we have in our fridge or freezers, but this very one requires exceptional infrastructural deployment. So coming back, what clearly comes out, okay, check our budget, 2021 budget, allocation to health is 7%. Less than AU requirement of 15%. Yeah. So that means that we have not even learned our lessons. Right. For what Bill Gates said, it meant that the confidence of Nigerians will start coming when they see that primary healthcare related issues are being addressed, that the state, federal, and local governments are responding positively to health matters. Even the private sector is also not exonerated. If you check the private sector, the CSR budget, over 70% of them go to entertainment and related issues. Even when they're dealing with health, they exclude primary health care. So we must deal with both. Yes, there must be a plan of action to get the vaccine. And even at that, 16 million does not look like 10,000. Is a lot. And we need to see evidence-based demonstration that the government or the stakeholders are prepared even when the 16 million comes, so that most of it doesn't waste.
So as it stands now, we don't look prepared. Is that what you're saying?
There had been a feedback from the DG of NIMA, Nigerian Institute of Medical Research, that we don't have enough infrastructure to store this, though it was counted by another agency. But it is important that we address those things from this patriotic point of view, not from being politically correct.
Oh, yes. Those are two critical issues.
True.
Yes. Okay, let's get back to Gertrude now, still talking about vaccination. And you said that there is a struggle to vaccinate people, but there are concerns that there is a situation of vaccine nationalism where countries, first world countries, are scrambling for this vaccine, and so it's not getting across to other developing countries. I wonder what you make of this.
It's a real situation that people are grappling with. But what we have to remember is to put it into perspective. When they were trying to manufacture the vaccine, or trying to actually develop the vaccine, the pharmaceuticals over here in the US and perhaps in the UK was backed by the government. The government took a lot of risk by putting down billions of dollars to give the pharmaceuticals assurance that regardless of even if the vaccine doesn't work, the pharmaceutical companies were not going to lose big time in terms of money. So that assurance kind of puts them in the first seat. However, I know that they understand that this is a global disease. It's a pandemic worldwide. So they need to look at the resource poor settings, like a lot of countries in Africa, including Nigeria and other countries around the world, that you need to attack the disease there. You also need to vaccinate the people in these countries for us to be able to stem this globally. And so the World Health Organization is working with Gavi, which is the Global Alliance for Vaccine and Immunization, to help discount, in addition with the pharmaceutical companies, to discount these vaccines when they come down to resource poor settings like Nigeria. So it's going to take a while. Even here in the US, we will be very thankful if we could vaccinate everybody before September. So even though they had put pre-orders of these vaccines, the manufacturers cannot make them fast enough. At the same time, be aware that they have to share with the rest of the world. So I know that what's happening right now is that the pharmaceutical companies are getting into partnerships with other pharmaceutical companies in other areas of the world apart from the Americas, including America, Canada, and then United and the European countries. So those areas, so when you see a drug or vaccine saying they must not be sold in the US or used in the US and Europe or the Western part of the world, it's because they had special arrangements to make sure that those pharmaceuticals that are produced for the developed world stays that way. But they realize that the world is a global village, and we have to take care of this not only in this part of the world, but in other parts of the world. It will take time. Even if you look at United Kingdom, you look at France, Germany, their uptake of vaccine is not that much. Right here in America, as at Friday evening, I think we were approaching about 11%. In a lot of states, it's up and down. So some states are better than others. Some states have gotten so much more than they have given. There are a lot of logistics issues, which I presume we're going to have that also in places like Nigeria and other parts of the world.
Indeed.
So, yes, there will be vaccination, but we all have to be patient. What we need to remember is that the same things we've been talking about since the beginning of this pandemic: wash your hands frequently, wear your face mask, social distancing, use sanitizers. Those things are still paramount. If we all endeavor to practice this, we will slow down this disease. We will.
All right, let's bring it to the studio here now. You have heard what she has said. There's still a struggle, even within the U.S. and amongst even these first world countries, as they are called. And so that brings us to the issue of homegrown solutions, which a lot of persons have been calling for. And the Association of Medical Laboratory Scientists of Nigeria is saying that we have the capacity to come up with something. All we need is funding and the right facilities that we can push forward, such that we can develop something as time goes on. Because from what she has said, it's still a struggle, and they are still looking at perhaps till September before you can talk about having vaccinated everyone in the US.
So I am clear that, and it's very obvious that the solution lies with us, but the solution squarely rests on leadership.
Right.
And the leadership cuts across the private sector, the public sector, and the social sector. One of your guests last week highlighted that even some of the vaccines developed in other parts of the world, there were Nigerians who were involved in the process.
Absolutely. Yeah.
So from the institutes that are into various medical research to the eggheads and other technocrats in our universities, good thing the universities are back. I figure out that the private sector in other parts of the world, the private sector gets involved. We are in a recession. Nigeria is in a recession. So we recognize that the government may struggle with funding. So private sector and government can hand a proper handshake. Put in place a governance system that guarantees that goals being achieved. Not that, okay, you donate money for the purpose of being politically correct. So we have the solutions. We have people who can provide homemade solutions. After all, India was not there at the beginning, but they now have their own vaccine. So we have capacity not only to develop the vaccine, we have capacity to develop drugs that can bring cure, that can ultimately be accessed by other parts of the world. So it comes to solution. Let's go beyond talking about the problem. Let the mindset be being part of the solution. As private sector, being part of the solution. As academics, being part of the solution. But as government, leading from the front, providing the enabling environment. So you may provide a seed fund and ensure that you demonstrate transparency in the way and manner the funds that people commit, private sector and other stakeholders, even the elites, they commit to it, to make sure that the process of rolling out our own vaccine, or even the cure, as it were, we achieve it quick. The thing is, it's important to know that out of enlightened self-interest, some jurisdictions in the world, the elites come together. Because the COVID-19 showed us that you may have 300 billion, 5 billion, 1 billion in your bank account, but you don't have the luxury of catching up a flight to go for medical treatment abroad. And so many billionaires have died in the course of this COVID-19, this pandemic. So I make special appeal. Let us work together. Let the government take the lead, demonstrate its sincerity, and reach out to both private and social sector players. That is what will bring solution to this. And that will also deal with the primary healthcare issues. Because why Nigerians seem to be, a lot of Nigerians seem to be living in denial is that many are dying from different pandemics. So they desire that government shows sensitivity to what their own situations, and that starts from fixing the primary health care. We can't run away from it.
Absolutely.
And that's what, as Health Emergency Initiative, we identify with the pain points of the people, especially primary health care related cases.
All right, Gertrude, one other issue that has also come up is this particular drug called Ivamectine, which some health professionals tout rather as a wonder drug. Some say perhaps it can act as a prophylaxis. I wonder what information with regards to this that you can hand down to us, because there are concerns as to its use, dosage, and all of it.
Thank you. I know this has really been in the news recently, and even the conference I had this past weekend, I had like 3 or 4 conferences, and the issue was brought up each time. I am an infectious disease physician that practices over here in the United States. And over here, there's a body that is meant to recommend medications for therapeutics for any condition. Usually, it would be their pleasure to recommend it, but they do things a little differently over here. You have to have strong evidence to make such recommendation that's going to be worldwide or even countrywide. The issue with the ivermectin is that the reason why the authorities here in the United States have not approved it is because they don't have the good data to back it up. So from over here, if you look at the different studies, there are different studies done. Some of them are investigational, some of them are retrospective, some of them are very well designed studies, like the one that was done at the University of Lagos recently, which was, double-blind, placebo-controlled, randomized study. The problem is that study was only 62 patients. I personally know a lot of the people involved, and I trust them in that study, but that's not the issue here. It's not about trusting, it's about the study size. If you have 62 patients and they were randomized into 3 groups, that means averagely you have 20 participants in each group. And so you have the group that had the placebo, the group that had 6 milligrams, the group that had 12 milligrams. it's hard for you to convince scientists over here to make recommendation based on that kind of data in terms of amount of people that are involved. Now, the way I saw a meta-analysis where you bring all these studies and put them together, but they were all done differently. And so you can't put them all and sum them up and say, oh, if you put them all up together, you have about a couple of thousand patients or several thousand patients. But they were not done the same way. So it's difficult to make recommendations based on that. However, I say this to say that in our situation in Nigeria, it's a little different. We don't have that many resources. So if ivermectin is a relatively safe drug, there are few situations that it may be risky to give it to someone. But if people want to use it, I'm kind of on the fence. I'm not telling anybody not to use it, and I'm not telling them to use it because I don't have the data to back it up. But if people in Nigeria feel that it's useful and they can be used, that's something that they can do with. It'll be very easy to conduct a larger study constituting thousands of patients, and it will be, it will hopefully answer the question. And I do not know that the CDC in the US is putting any such study anytime soon. I also want to mention that Merck, who is the pharmaceutical company that produces ivermectin, put out a strong statement this last weekend, towards the end of last week, saying that they don't see any data, they don't see any reason why ivermectin will work for COVID, both for prophylaxis or treatment. So all those things, you have to take them into account. But like I said, in a resource-poor setting like Nigeria, if we think that this could be useful for us, we can go ahead. I mean, I'm not saying do it or not. We have to remember that COVID-19, at least in the Western world, the estimated 81% of the patients that get COVID-19, regardless of what we do, will be okay. They may not even need hospitalization. And again, let me say 81% of the people. And the people that may need hospitalization, about 19%. And out of that, about 5% of them gets into the ICU to the point where, we are trying to do ventilator and all that. But we have to remember that we have a much younger population in Nigeria. That number might be a little skew on a higher side. And so putting all this in perspective, I'm saying that sometimes people will recover regardless of whether you give them any other kind of medications like that. Thank you.
A very interesting point there, Gertrude. Pascal, even reports are on now that you see pharmacists saying that this drug is off their shelves. Everyone is seemingly purchasing the drug as a prophylaxis, and it's raising concerns because some persons say there might be side effects to it.
In my neighborhood, I saw over the weekend a pharmacy that displayed they have the drug, and it's for COVID-19. And I curiously went, so is this OTC, over-the-counter drug? He said yes, that they sell at any time. And because it's relatively cheap also per tablet. So my concern is that NAFDAC needs to stand up to this and other regulators to make a pronouncement, standardize it, even though drugs can be repurposed because this is essentially for river blindness and other parasitic infections. But because of the way things happen in Nigeria and there's no control, most times, so NAFDAC and other regulatory agencies need to step into the space to avoid misuse of the drug, to avoid the likelihood of side effects that it could bring on persons who are doing it out of ignorance.
Yes, so which is a major concern for NAFDAC. We talked about standardization, creation of a fake, version of ivermectin and all of it, and the prices already soaring.
It's soaring and out of stock.
It's a tough job or a tough call for them as we speak.
It is, and perhaps it's not only NAFDAC, other stakeholders that have a role to play, or concerning even the PTF need to all work together to make sure that they clear the air on that. If there is need for quick clinical trials that suits our circumstance here in Nigeria, that could be explored. But Again, everybody must stay safe. There's no cure for COVID-19 yet. The vaccines, even though they get here end of the month, it would take months before it will get to the grassroots. So the safest thing is...
looking at, it's not everybody that will be vaccinated. It's just a number of persons, more like herd community,
true.
immunity rather, that the government is looking at, which is another thing that some persons are saying. How effective is this herd immunity going to ensure that it slows down the curve when you talk about the pandemic? But then we'll wait to see how things pan out as development unfold. We must thank you, Dr. Gertrude Chimeka Anyawoke, Medical Director, Infectious Disease Associates of BR and Baton, and ANPA COVID-19 Task Force Chair, ANPA Louisiana. Thank you for your time on the program. Thank you, Pascal Achunini, CEO, Health Emergency Initiative, for your time as well.
Thank you for having me. I appreciate it. It's my pleasure.
You're welcome.